Hey, this is Doug Field, CEO of the Institute for Healthcare Consumerism, along with my co-host and managing director, Brent Macy, and welcome back to Healthcare Consumerism Radio. We're excited about this next phone call because it's going to focus on innovation around smartphone. That's where a lot of activity is. And coming to us from California is John Halloran, CEO of Mobile Health Consumer. John, good morning to you.
Good morning, Doug. How are you today?
I'm great. Hey, great to have you on the program. Appreciate you taking the time out of your day.
Thanks for having me.
Yeah, you're welcome. Hey, give our audience a backgrounder on yourself and Mobile Health Consumer. I really like, you get an interesting, well-experienced background. I like what you're doing with Mobile Health Consumer. So.
Well, good. Hey, and I appreciate the comments. My background is I've got a background in healthcare, in technology, and in talent management. So if you sort of think about those three elements, kind of what we're doing may make sense here. From a mobile health consumer perspective, you know, our mission is to simplify healthcare for consumers by making their health top of mind. And we couldn't think of a better way to do that than to get personalized, health content directly to their smartphones, because, we all know that we're all checking those our smartphones, 50, 60, 100 times a day. And instead of playing Angry Birds, we thought we could use that addition to our smartphones for something more useful.
That's exactly right. And you're doing this via mHealth app is the app, right?
That's exactly right. Yep.
And so talk about the different moving parts and elements of mHealth app, from mobile, social, personalization, analytics. To give us a kind of an overview of that, if you would, please.
Yeah, that's a great setup. So the first thing I'd say is, if you think about, we use the app as the connection to the consumer, again, to take advantage of their addiction to mobile devices. But there's a lot of embedded capabilities. It's really a platform. So think of, LinkedIn or Facebook. This is really a LinkedIn or Facebook for healthcare.
Okay.
There's analytics built in that will predict, based on your current health, what are your likely health risks, and what are the things, if you started working on them today, would help you maintain and improve your health over time, and what you can do, where you can go. So really trying to take the basic elements that are now spread across a lot of different places and deliver them all right to the mobile device. And that includes social support. It includes things like gamification. A lot of employers know that it's important to keep not just their employees healthy, but the families of their employees healthy, because nothing would be more distracting to an employee than if they've got a family member home with some preventable illness that they could have done something about. So think about it as how can we make these topics of my health status, how my health is, what I can do about it, so it's more top of mind, and I'm more educated, and I can take more accountability for my health. So we've built in a lot of different capabilities to support that mission.
Can this work in conjunction with a lot of the wearables that are out there being promoted as part of the solution?
Absolutely. We're already hooked into Fitbit. That's one of the populars. We've got about 5 or 6 that we're connected with today, and we've got the list keeps growing because, Doug, there's so much innovation in wearables, and we're just really happy to harness that, because our view is that if the consumer is comfortable with a given wearable, whether that's Nike, whether that's Fitbit, whether that's Jawbone, we shouldn't get in the way of that. We should allow them to continue with what they're comfortable with. Our role is to really take that data in, enable them to earn rewards from their employer for staying active, enable them to compete with their colleagues, enable them to stay, get the social support, but to retain the device and wearable that they're comfortable with.
Yeah. John, is your primary distribution via the employer to then their employee consumers, their employee consumers' families?
Doug, great question. I'd say we started there, and like most, interesting ventures, we've sort of been dragged in several different directions. So it started at the employer level. We're seeing a lot of interest now from health plans, and we also see a lot of interest from health systems who are really getting themselves prepared to take on more risk as we move from a fee-for-service payment model to a shared risk model with the health plans. some of the provider organizations are starting to look at this and thinking that, how can I create a digital relationship with the members that I'm responsible for in a scalable, cost-effective way? And mobile is obviously top of mind.
With talking about the provider, you bring up some. So, do you have plans to provide via your platform connectivity to an electronic health record?
That's exactly right. We're working on that as we speak.
Excellent.
We've got several relationships that we're sort of in process with relative to that topic, whether it's directly with a electronic health record or whether it's there are a lot of now care management platforms that are being developed that integrate with health records that measure the pay-for-performance metrics of a provider group, which determines sort of what their reimbursement level is from the health plan or from Medicare. So there's a lot of innovation and change happening with healthcare reform that's really we're trying to provide an enabling platform for organizations who need to maintain a cost-effective digital relationship with their consumers.
Yeah, it's a challenging, innovative, chaotic time right now. We talk about that every week, almost every day. The amount of innovation taking place out there, which is very good. I mean, very, very good for this market.
Keeps us out of trouble.
Yeah, it does.
Hey, John, this is Brent. When you kind of started looking at what you were going to build out with this technology, what were a couple of things that you noticed in the market that said, hey, we got a pretty good opportunity here with this? So that's my first question. And the second question, do you have a client case study that's utilizing this product right now?
Yeah, we have a lot of clients, real revenue, real clients. We just presented at the National Business Group on Health one of our clients about the results, the outcome improvements they were able to achieve by using mobile outreach. That company, it's a Fortune 500 company in the technology space called Western Digital. They're also out here in California. And, obviously with their population, everyone's walking around with their smartphone on their hip. And they love the fact that we're able to sort of consolidate the capability right onto their smartphone. The other thing that we were able to do with them is show, dramatic improvements in not just initial engagement, which is, there are sort of ways that if you have a strong communications campaign, you can get good initial engagement. But what we're seeing is very high return use rates. So really what we're trying to prove, the thesis we really wanted to prove was if we made things simpler and moved it to the device that everybody's addicted to, that health will become more top of mind. And we're seeing that. And so as we're seeing the return usage rates increase, we're seeing, personalized communications get read more often. We're seeing people who are out of compliance with HEDIS or evidence-based medicine become compliant because now we're reaching out and educating them, and here's why you want to do this, and that employer sort of provides an incentive for them to become compliant. So it's a really interesting case study that if you're able to personalize content, technology enable the outreach and provide behavioral incentive, you really have a good shot at moving the needle. And that's what we found with that client. We also have Fortune 500 clients across, banking, large health systems, and then we scale all the way down to, we've got clients that have 50, 60, 70, maybe a couple hundred lives. So, one of the advantages of going with a company that's in the cloud and using mobile first is, we've got a very rapid deployment model. And so it makes it easier to sort of get the value out and get the capability out in front of the consumers quickly.
Now, from a product build-out standpoint, do you guys have any, and you mentioned some of it earlier, do you have some ideas that are on the horizon to continue to build the depth of the product?
Yeah, we do. It's we're really interested. The wearables was a really, that was a good initiative. We think about it as we want to be able to address the entire population. So whether it's an employer, a panel of patients from a provider, or a population of members for a health plan, we want to have something to keep the healthy. The walking programs, the social support, the incentives to get screened, to get educated on your health status. Then we want to be able to for the folks that are diagnosed and are dealing with and trying to manage through having a chronic illness. We want to keep them adherent, and that's all sort of what we do today. I'd say the next phase, Brent, would be how do we provide more of an early warning system? How do we connect to blood glucose monitors and do more of that remote monitoring and provide some of that communication so that the consumer doesn't really have to think about it? They're monitoring their blood sugar, and they get notified and their physician gets notified that something's out of whack, because it should just be, you've probably heard the analogy, it should just be like the warning, the engine warning light that goes on your car. That's what your mobile phone's going to be. I think we're a little early to really be there right now, but those are the kind of things we're thinking about as we think about where we want to take the company and the capability.
That makes a lot of sense, John. Let me ask you about distribution, coming back to distribution, because you're kind of, finding, your market, health plans, providers, employers. How about exchanges?
Yeah, it's a great question. We're very, very interested in exchanges. We think, we have an exchange. We created we just signed an agreement with Assurex to be the exclusive sort of health promotion partner in the Assurex exchange, and so we were very excited about that. We think that, as there are more and more exchanges, and those exchanges have to compete on value, and those exchanges have to compete on how effectively they can keep the population within them healthy and therefore keep the cost stable. We think that those exchanges will look for solutions like this more and more.
Yep.
I'd say that I really compliment Assurex. I think they were out front in sort of their thinking about how they should think about having a stable cost basis in their exchange. I think others are sort of getting up to speed and just sort of getting the operational underpinnings going, and then I think they'll start thinking about risk management and how to maintain costs over time and the like.
Yeah,
but I think that could be a very interesting emerging opportunity for us as things develop.
Okay. Yeah, John, we got about a minute left, and just want you to be able to leave our audience with one or two key takeaways, and then definitely let them know how to find you guys.
Sure. Yeah, thanks. Appreciate it. So I would say the biggest takeaway is, we always like to say that healthy talent is productive talent. So specifically for that employer market, if you've got large employers that are self-funded and they're really focused on how to get the most out of their people, it would be like having a fleet of trucks and not changing the oil, right? So we want to make sure we keep that talent healthy and productive so those businesses can flourish. And we want to keep their families healthy, too, because that'll keep them focused. You can find us at mobilehealthconsumer.com, and you can find us in the App Store, the Google Play Store. So we're sort of all out there in the cloud. So appreciate you guys having us on there this morning.
All right. Thanks so much for your time, John. Have a great weekend out there. And to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.